Tēnā koutou, tēnā koutou, tēnā koutou katoa. It's my genuine pleasure today to see the large turnout we've got to hear two highly respected international speakers for us today. Recently, our secretary, Dr. QALY McLeish, outlined a work program which will culminate in what we call our Wellbeing Report at the end of this year. Te Tai Waiora will be a report of the state of wellbeing in New Zealand and how that's changed, how it's distributed, and the sustainability of that wellbeing. So this seminar series is part of our broader wellbeing work program, and our aim here is to bring in external ideas as a source of challenge and intellectual stimulation. And we want to share that opportunity to learn with interested people across New Zealand. We'll have a range of seminars over the remainder of this year and into 2023 with participation of international and New Zealand wellbeing experts. But today we're most fortunate to have two very distinguished speakers from the London School of Economics, who I briefly mentioned. Firstly, Paul Frijters, who's currently Professor of Wellbeing Economics at LSE. He specialises in applied microeconometrics, including labour, happiness and health economics. A prominent research economist, published over 150 papers in various fields, and in 2009 he was voted Australia's best young economist under 40 by the Australian Economic Society. And also we're fortunate to have Christian Krekel, Assistant Professor in Behavioural Science in the Department of Psychological and Behavioural Science at LSE. Also a Research Associate at the Centre of Economic Performance, LSE, and the Wellbeing Research Centre, University of Oxford. And Christian's research looks at how our environment affects our lives, specifically our behaviour, health, and ultimately our well-being. He's a frequent advisor to national governments, the World Bank, OECD, including how to use wellbeing data. And Chris has been awarded the Young Economist Award by the European Economic Association. So today, Paul and Chris will guide us on explaining around Wellbeing Years, or the WELLBY concept as it's known, to cost-benefit analysis, as recently adopted by the UK administration. And this is highly relevant to New Zealand as we are trying to increase the use of our wellbeing analysis in our policy. And indeed, these two gentlemen have already been highly influential in our work. So we last year adopted WELLBYs into our internal CBAC's cost-benefit guidance as well. So let me say no more because you're here to hear Chris and Paul, but I'm very much looking forward to hearing from them about how WELLBYs are being used by governments and large organisations and policy around the world. So the format will be Chris and Paul will take us through about 45 minutes of slides, and then as typically we'll open up to questions which I'll moderate. Thank you, gentlemen, please.
Paul, you're on mute.
Paul, you're on mute still.
So, welcome everybody. We've got the technology right, and it's great to be again in New Zealand, if only virtually. I hope to visit personally very soon, because it's such a beautiful place with many friends. I'm going to talk for the first 20-25 minutes, basically about sort of the background framework set up and some of the results, and then Christian is going to talk through some examples. And we'll have questions at the end, so please keep them in mind. So we're going to talk about principles and examples, and it's handy to start with, as it were, a quick reminder for those who don't know, and to be honest, 10 years ago, I had no idea about what economists were up to inside departments around Western bureaucracies in the whole world when they were doing cost-benefit analysis. I mean, economists all get trained in an undergrad and postgrad degree about the principles of cost-benefit analysis, but that has precious little to do with what actually happens in departments, right? And it's because we're presented something sort of pristine and perfect in class, which to no degree exists in reality. So you sort of have to take off the blinkers that you get put on in undergrad degrees and see, well, what do they actually do? So what do rich countries do? They do cost-benefit methods, right? They estimate how various outcomes YK, so that's an outcome, and the K sort of goes over a set of sort of dimensions, will change with some amount delta YK. So delta YK is the effect, in some sense, of a policy, right? That could be the number of crimes, the number of park visits, whatever it is. And then you try and sort of translate those changes in outcomes to a bottom number, and you do that by putting a price on those outcomes. And you look for a dollar value, right? And you use agreed upon discount rates for changes in the future. So you have some sort of notion of the population on which it affects now till infinity, and you have some notion of how much in various outcomes, and you try to put prices on that and try to put the future into the present. Now, preferably economists look for a market price if they look at different outcomes. And if they can't find the market price, they try to go for second best, and one of the second best things is some notion of willingness to pay. You add them up, and then you talk about the benefits. So the benefit of the policies are effectively the sum over those changed outcomes times the price that you've got for the outcomes. And you compare that with some notion of cost. That could be an upfront cost, but it could also be the future cost of less tax revenue, the future cost of higher health expenses, or higher education expenses, higher prison expenses, whatever it is, right? And you can work with those things. You can call them the cost-benefit ratio, cost effectiveness. You can also net present value. You can do all sorts of things with that. That's what you do. Now, it's important to have some commentary on this. One is that we're not looking at an evil methodology, but more as some kind of attempt to be rational by bureaucracy, right? It's some attempt at accountability. It's saying, now, look, this is the best we can come up with as to what these policies do. It's not perfect. It's more like a leaking bucket, I think of it. But at least it's some attempt to sort of set up a methodology by which they can answer, well, why did you do this and under what assumptions? And nearly always, when it concerns complex policy that affects a lot of people in a lot of different ways, you're looking at something that's glued together, right? So the various estimated change in outcome don't come from a single model, which is what an economist would like to see, a single model that explains everything in the world. That model does not exist. Nobody's ever seen one. It's impossible to think of one, far too complex. So you effectively have a horses for courses kind of attitude in which lots of different models, which are strictly speaking totally inconsistent with each other, are used to estimate changes in different outcomes across time and across people. And you glue them together, and that always has a bit of fudge in it, inevitably, because the only way you won't get fudge is if you do have the model of how the whole world works, and no one has any chance of that. Right? So you really are then relying on rules of thumb, stylized models, simplified alternatives, lots of sort of gluing assumptions and views of the world. And every country has different methodology when it comes to cost-benefit analysis, and even every government department has them. And within every government department, you can even have different teams which have slightly different views of the world. And so there's no such thing as sort of a single view of how to do cost-benefit analysis. But if you sort of gloss over the many, many differences across those, I would say that it's sort of the economic view of the 1980s and 1990s that dominates that world, at least until recently. If you think of the thing that they're trying to maximize, it looks a bit like economic surplus and willingness to pay. And I don't say this so much as a critique, it's more a reflection of the times that was what they thought was the value and what they could have some handle on, that they're trying to get to it, right? Now, a typical example is the following. This came from the valuation by the UK Airports Commission, which was supposedly independent and run by the Department of Transport, which was clearly sort of a captured undertaking. They tried to work out what a new runway would have in terms of cost of benefits. And so then they come up with a table like this. And CT and CC has to do with carbon capture, but it doesn't really matter all that much. What matters is that they have a list of outcomes, and you see them there: producers, surplus, noise, air quality, and then you have other outcomes. And they try and put numbers to them, right? And they put numbers in terms of, okay, consumer surplus is going to go up almost 55 billion. Where does that come from? Well, the notion is that the supply curve shifts out, and so the price should drop. There should be more consumer benefit. But deep in the bowels of that report, you will find that they don't truly expect price to drop. They don't truly expect that consumer surplus to go up at all. but they use this as the headline number in order to get a big benefit, in order to sell it to politicians. That's sort of admitted deep in the report. So effectively, this headline table, which shows up in their main conclusions, is a lie. But that's less interesting from our point of view than just how they do it, right? So these all come from different models. Noise comes from different models. Carbon emissions come from different models, and they add them up, and they talk about net social benefit. They talk about NPV. And then they've got other stuff in there, which they know is likely to change. They're willing to say, well, green goes up, red goes down, but there's no number on it. And what do they end up with? Well, then they basically define everything with no number as non-economic, even though the economic bit does have noise in it, biodiversity, whatever it is. But whatever is not a number is not economic effectively. And then they say bling, bling, bling. There is, benefits of 69.1 million. And I hope you notice that that's exactly what the table says in total benefits. So this really is the table that leads to the end conclusion. They say, well, that headline number is totally made up because it's based on the price they don't actually expect, is bigger than the made up number of some other scheme. And so this is what we should do. And that's more or less how it goes. Now, note particularly that this really corresponds to the old economic saying that if you don't measure it, it doesn't count. Now, what are some problems with this CBA as usual? Well, one thing is that a lot of the stuff that we humans care about are not things we pay for. So there's an obvious market price of willingness to pay. So for instance, we value our children and our partners, but we don't pay for them. And we'd be rather offended if you asked us, well, how much are you willing to pay for your wife or your husband? I mean, we'd sort of answer with a joke, well, how much are you offering? And people value their mental health, but they don't know what affects it. They don't know how to buy it. Right? So they're sort of ignorant of the production of mental health, but they do value it. They value public goods like the environment, and we know that's a problem because it's not traded. Willingness to pay is hard to elicit for many environmental goods. People don't really know. They value friendship, but again, would be offended if that were put in dollars. Almost the definition of a real friend is that you don't put a monetary value on it. Then there are, of course, consumption externalities and limited awareness. Limited awareness of violations of rationality, but there are lots of things we don't know well, right? In the 1950s, we didn't know about passive smoking, and there are many government departments predicated on the notion that the public has limited understanding of all sorts of things. It's their job to generate the information, like food standards. But also, there are negative consumption externalities. We know this as status, for instance. If the neighbors get a bigger car, I'm jealous. I also want to buy a bigger car. And so their bigger car negatively affects me. Now, that's not in a market price. It's not in willingness to pay. But it's definitely utility. It's definitely part of how I feel about things. And so the essential problem is that money is not the ultimate measure of value. The ultimate measure of value is how we experience life. To become more scientific and inclusive of social life and the environment, you must, as it were, again, improve the leaky bucket and measure what's important. So this means that the dominant CBA evaluators don't know how to value social life. They don't know how to value mental health and the environment. And for analysts, this is not often a problem. It's more like a handy thing, because if their boss asks them, look, make a CBA of this, and there's nothing sort of easily available for them, they go to the simplest heuristic possible, which is just presume, well, we don't know how to value it, so let's just say it has a value of 0, right? So the usual solution by analysts to the problem that their mainstream models doesn't allow for them is to presume it doesn't exist or has no value. That makes it easy to calculate. You don't need a model. You don't need to predict changes in social life, mental health, or the environment, all that sort of hard stuff, right? So the brutal reality of this is that unless you explicitly adopt a measure of value that does easily relate to social life, mental health, and environment, then CBA analysts up and down the world are going to continue to assume they have no value, because that's far easier and far less contentious and requires far less work for them than presuming it does. And note in that regard that the 17 Sustainable Development Goals, they relate to at least 900 odd individual indicators, and in that sense wholly useless, right? Because there are far too many of them. And you then need a 900-dimensional causal structure in order to have any notion of how a change would affect all those 900 indicators, many of which are very easy to game and are sort of not robust statistically. So also sustainability advocates need something much, much simpler than the 17 Sustainable Development Goals and its 900 odd individual indicators, which are breeding more and more indicators every year, in order to get sort of anywhere within cost-benefit analysis land. Right? One needs something that is reasonably robust, doesn't have to be perfect, but at least captures a lot of the value in social life, mental health, or the environment. That's really where the idea of the WELLBY comes from. Is the idea of the WELLBY is that we want to help bureaucracies capture the value of some of the things they affect with a fairly robust tool in which we already know a lot. And so the idea is the WELLBY goes back to the Enlightenment, 17th, 18th century. One explicitly wants the government to maximize happy years lived. And within that framework, you can then value anything that makes life enjoyable. So that via that lens, it's about the length of life and quality of life of a population. And the quality weight is crucial. The length of life is crucial. For the length of life, we look for life expectancy. But the quality weight that we've sort of boiled down is how satisfied people themselves say they are with their life. And we consider that like a vote on what they have experienced. So the democratic system gives you a vote on a whole set of policies or whom they trust most. But there's also information on how people say they've experienced life. We basically have more information on that. And so we see it as part of the social contract, that this is roughly what a bureaucracy aims for, with, of course, the approval of the people, and also partly with checks of sort of the democratic system. So where is then the UK life satisfaction question? There are various versions, but this is the one that since 2011 has been in all major UK data sets. We ask overall, how satisfied are you with your life nowadays? A 0 would be not at all, and 10 is completely. And what is mainly important about this kind of question is that you ask something to do with overall, so that you remind people it's about life as a whole. It's something to do about your own evaluation of your own life, so satisfied with your own life. And some notion is that we're not precise about the timing, that it has to do with nowadays, these days, the formulations vary, but that it hence has this element in it of you looking on your life as a kind of a trajectory. It has past, present, and future in it, and how do you think you're going? And we define the WELLBY off this, right? So one WELLBY is then one unit of this life satisfaction. So a change from 0 to 1 is the same as a change from 7 to 8 on a 0 to 10 scale for one person for 1 year. So we start to interpret this as a flow of utility, whereas it's not actually flow, but you can interpret it that way because you then define this as the object of maximization. And we know an awful lot about this, right? There are something like 200,000 studies since the 1930s on this thing. We know an awful lot about life satisfaction. Lots and lots of experiments, lots of bad studies as well, but there really is an awful lot of information. And for instance, we know that a normal level for somebody who's very healthy is roughly an 8. So somebody who says, you know, they're in excellent health, if they have average outcomes for other stuff, they're about an 8 on this scale. We also know something about when people are indifferent. We've known the methodology since at least 1999. I wrote about that in my PhD thesis, but other people have thought similar things. We effectively asked people, look, if you were to live another 10 years, but it would have to be at a life satisfaction level of 1, would you say, well, rather not? I'd forego the pleasure of living in that kind of misery. Or would you say, well, yeah, I prefer that over not living at all? And round about 2 is the level at which over 50% start to say, well, no, not. So this indifference point with life satisfaction between life and death is when you say, well, I don't actually want a life that is that miserable. Is you know, the best estimate at the moment is around 2. We'd like a better estimate. The UK Treasury has taken 1 as it's saying, but this is very much an empirically live point. Now that is very powerful because that means that 1 year of good health is worth 6 to 7 WELLBYs, and that would hence be one regular year of happy life. And by saying that a regular year of life is worth 6 to 7 WELLBYs, that means we can trade off length of life for anything else that we know affects life satisfaction. So that includes social goods. It includes the environment. So we can talk about how many months of life a marriage is worth. The answer is roughly 2. We know how many years of life the lack of a depression is worth. The answer is about half a year, right? And so we can sort of translate those 200,000 studies into what we know about life satisfaction into trade-offs. And so the WELLBY captures almost everything that's important to people. And for instance, the main alternative with QALY is physical health. What they miss is joy, status, and things that give fulfillment. So things that make life worthwhile are not really in QALYs. It's not really reflected in those questions, but they are in the WELLBY. And also the whole status thing is important. Now, how does this work in CBAs? At the conceptual level, you're then maximizing the expectation of this large beast of an equation, which is essentially the expected life satisfaction of the population. So you sum over time from now till infinity in principle. There's a discount rate, that row thing. And then you sum over a set of individuals, which should be the population you have in mind. You can have social weights. You shouldn't think of this as racism or discrimination, but for instance, more that somebody who has free passports and hasn't lived in New Zealand for 20 years might not count as much as somebody who's living there, right? So that's the SW's weights, and then you basically count the life satisfaction over and above that 0 point, which is hence 1 or 2. Now in calculations, you never actually calculate these things, although there is a Spanish guy who actually has a whole website where he's calculated this thing for every country in the world, and even changes in the last 2 years due to various policies. You use predicted changes. Just as with CBA, you will never actually see the total welfare of the population. You predict changes in this thing by concentrating on the various groups you think you can say something about. And as I said, you've got 200,000 studies to work with. A lot of that is grey literature, a lot of that is government reports. And that gives you a huge price list. So we know a lot more about this WELLBY than, for instance, we knew about the QALY or the GDP when that became live. Now, if you then think of those CBA calculations, what you do is not so different from what you did before, right? So it's the same procedure as otherwise. You'll still be having lots and lots of different models, which are strictly speaking inconsistent to come up with these changes in various outcomes. So in that sense, you still need to do your best to say how the world works and what the important outcomes are. But you have two different things. One is that you now have a different idea as to what's important, because the life satisfaction literature gives you a different sense of what matters. Particularly social life suddenly becomes a lot more important than hitherto accounted for. But also you can have price lists which are different. We're no longer thinking about willingness to pay or a market price for the relevant one. We're thinking about the WELLBY price of different outcomes, YK. So your price list comes from somewhere else. And you then decide on different policies on the basis of how much WELLBY per unit of public funds you're buying. And the weighing and the WELLBY of social life in the environment, that is now an empirical question. That now has to come from knowledge on life satisfaction, but we can already say that is far higher than it is in traditional CBAs. And so the thing that goes down in as it were, WELLBY calculations versus traditional CBAs is things that only give you more material goods. That becomes less important, so it's less about the size of the house, it's less about how many washing machines you can have, and it's more about whether you still have good friendships, whether you can see them, whether your mental health is good, and whether you have a pleasant local and international environment. So in practice, the goals of sustainability and social life are aligned with Wellbeing CBA over a traditional economic CBA, mainly because the price is different. Now, what does then well-being cost effectiveness boil down to? Well, you play with two aspects of this. You think of the net benefits of some large policy change to the status quo, and you think of the public cost. And the net benefit is now in terms of well-beings, and the public cost is the whole of government net costs. So you think of now to the future, you think of all kinds of government departments, so it's a whole of government lookout. And if the net benefits over the public costs are above some threshold, then you say, okay, we do this, and otherwise you say we don't do this. So in our handbook, which came out last year and will soon be available for free on the Oxford University Press website, we generated a graph. Here we summarize 15 policies. Quite a few are UK, but some of them are international. So there's also Pakistani mental health intervention for women in villages in there. There's the Olympics in there. There's a homelessness program, which is calibrated on Canadian data. There's natural lottery well-being programs, particularly cooking programs in community. That's about the most effective program you can do there. But also some private stuff like problem-solving training for flight attendants. Right? And the dotted marginal line is what the NHS claims is their marginal productivity. So they say for every £2,500, they effectively produce one WELLBY. And because that captures about 1/4 of all UK government expenditures, it's sort of a natural benchmark, if you like. So the natural benchmark that would come out of the NHS is if that you pay more than £2,500 for a WELLBY, you shouldn't do it. If you pay less, you should, because you're then more efficient than the NHS. Now, in practice, the UK Treasury has chosen a threshold of 10,000, largely for political purposes. They probably want to drive that price down over time. Now then, institutionalization, which is very important because we're very much sort of trying to help bureaucracies with this, right? We're trying to get this roughly right. As I said, the WELLBY is now adopted in the UK Green Book, part of the New Zealand CBA guidelines. But to grow, this practice needs several elements, and there's a lot of work happening on those elements. One is a general price list maintained by the bureaucracy, so a price list in terms of effects on well-being. The second is that, well, you of course need to start put well-being models at the forefront of your departments. So in every major policy area where you're going to need frameworks and models maintained by the relevant departments and institutions. So, you know, cultural departments need to start to have models of frameworks whereby they work out how much well-being various things generate. The same has to happen for transport. The same has to happen for media. The same has to happen for employment and social work. And that is just, as it were, a redoing a lot of the frameworks and models that they've made the last 50 years in traditional economic CBA. So there's just a huge task there. That takes a lot of time. There also needs to be extensions to group which are not easily capable of self-evaluation. So life satisfaction is a self-evaluation question which requires you to be aware of yourself, to be able to judge yourself. Well, a kid can't yet do that, doesn't have a concept of how their life is going. And of course, the demented have lost that capacity, which is why other people need to take care of them. So you need to figure out something to do with those groups and how to count them, and that is not so easy. Right? And people can reasonably differ on that. And the front runner is to have carers nominate how happy or satisfied those under their care are. Of course, you need training programs to teach methods. So there is a training effort there, and the UK Treasury is doing that. The Wellbeing Centre is doing that. You need generalized information on this kind of well-being for the whole population so that people can make their own choices based on well-being information. And you need inquiries, work groups, and projects to deal with the many problems that there are as they come along. So you also need an institutional setup to sort of learn over time what works and doesn't work well. Now we're sort of moving ahead, and we have moved ahead on this in the UK in many directions. So this is, for instance, an example of the price list, and we have things to do with finances, years of education. These come from the best sort of causal result literature that we have. But notice that this is the sort of thing a bureaucracy will need, a price list. Academics hate these kind of price lists because immediately 100 alarm bells start ringing. But what about uncertainty? What about that other thing? How did you define which group? Right? Those are important questions and they're very relevant. But if you leave it to academics, they will never, ever come up with a price list. So it has to be a bureaucracy that sort of decides on that. Informed by academics, challenged by academics, fine. But don't ask academics to as it were, maintain one, because all they'll do is come back with questions for more money as they sort of prevaricate. You also need frameworks. This is one that we made for child education, interventions for preschool. You don't need to look at it. But partly this is taken over by the UK Department of Education and the project they're doing, and this leads to a large micro-simulation model. And it's an example of the sort of thing you have to do with generalized information. There's what works well-being, which brings out a lot of stuff for charities, businesses, organizations. There's also information just on people's workplaces, right? So all that kind of stuff is basically happening. Then we can talk a little bit about the WELLBY of the QALY, but I think I will now hand over to Christian so that we have enough time for questions. Thank you very much. Christian, take it away.
Yeah, thank you so much, Paul. I will take over the control now. Oh, now something has happened, and I don't know where the presentation went, to be honest. Does anybody see the slides still?
We can still see the slides.
Okay, I clicked maybe on Spotlight. What is it if I say exit Spotlight? Is that a good thing? Or am I sort of exiting the entire application?
No, if you exit Spotlight, it's just, it shows you a bit larger on the screen for the attendee.
All right, so, okay, 1 second, please.
That's all right.
I do not see the slides at this point anymore. I see, yeah.
They may have dropped on your screen a little bit. So if you scroll down your screen, you might be able to see them.
No, I don't. I see Stuart quite large now, but that's about it.
What you might have done is you might have clicked on Struan and made him larger. So the slides have now just become a little square. So you now just have to click on the slides again. They'll be on your screen.
Exit Spotlight. Yeah, that's a bit weird. I can't see the slides at this point. Look for PowerPoint button in the bottom right. Persons, chat, reactions, apps, further, camera, microphones, share. I do not see any PowerPoint button.
How about, Chris, I take that control.
Yeah.
And
Yes, that would be fantastic. Thank you so much.
just say next slide and I'll go from there.
Brilliant. Thank you so much.
That's all right.
Okay, great. Thanks. I can essentially, if I say like take control, would that work? You think?
Yeah, if you try now.
Okay. Yeah, I think we're back. Perfect. Thank you so much. Okay, great. I'm going to talk about some examples now, how we used the WELLBY for evaluating policies and programs in the UK primarily. And one example is coming from Wales, which we also talk about at length in our handbook. And another example comes from recent research which we have conducted during COVID-19. So the first example, as I said, comes from our handbook. It's about a Welsh government youth traineeship program, which ran between 2015 and 2019. That was a program which targeted young job seekers aged 16 to 18, which were referred to the program, to this traineeship program by Careers Wales. And overall, there was an intake of around 16,000 trainees until December 2018. And what the benefit of the program was, according to the evaluation report, which was done by a consultancy, was that there was a 10% percentage point increase in job finding after completing this youth traineeship program. And the total costs of that program, which was not continued after 2019, was around £18 million. So what I'm going to show you now is primarily a traditional cost-benefit analysis, as we basically are all familiar with it, where we basically look at primarily consumption benefits and also costs of the program. I'm looking here, it's a very simplified cost-benefit analysis. I'm looking only at 3 time periods. I'm looking at benefits here, which come from an increase in total individual income per person, which can be broken down into a higher personal consumption and higher taxes. What we're also including here are sort of cost savings to the public purse. We take them from the Public Health England social return on investment tool, which are crime cost savings and healthcare cost savings. And we basically break down these benefits into these different time periods. We assume a slightly lesser benefit in the first time period and slightly stronger benefits in the second and the third time period. And then we have also here our program costs per participant. So we basically take the total cost divided by the number of participants, and we get a cost of around £1,145. That's the program cost. If we sum up all the benefits, so higher personal consumption taxes, the savings in terms of crime costs and healthcare costs, we get our benefits, total benefits. If we take the difference, we see it's a program that is indeed, according to this very traditional cost-benefit analysis, worthwhile, because benefits minus costs are positive, and there's a total benefit generated here per person by £3,362. So that's a very, very simplified traditional cost-benefit analysis. But we know from the well-being literature, which you're probably also very well acquainted with, and Paul has talked at length about this, that there's a huge evidence base already. We know that, you know, if you're basically out of work, you know, the sort of disbenefits or the misery goes much beyond just not having a certain level of consumption. But of course, we know from the life satisfaction literature that there are very few life events that cause more misery than being out of work. You do not really adapt to that hedonically over time. Basically, there is very little consolation if you live in an area of high unemployment rate and so on and so forth. So it's really, really bad. And it goes importantly beyond simply not having income, right? So there's misery that goes beyond that. And that is essentially left out of this traditional cost-benefit analysis. So what we can do is, if we want to account for this misery, we can conduct what we call a well-being augmented cost-benefit analysis. So we can essentially look at the life satisfaction literature, and there are good causal estimates now of the effect of unemployment on life satisfaction, taken, for example, from plant closures, which are seen to be exogenous. We know that a life satisfaction effect of unemployment is minus 0.46 points on a 0 to 10 scale. We take this from the literature simply. And then if we assume symmetry of the effect, so basically gaining employment simply turns this around. And if we assume that essentially job finding rate is 10% in the first year, and then according to the report, to the evaluation report of the Welsh traineeship programs, 20% in the second and the third year, we basically multiply this year by -1, and then by 0.1 and by 0.2 here. And then we get sort of like the life satisfaction effect of reduced unemployment. We can importantly always monetize life satisfaction effects. We know the effect of log income on life satisfaction, so we can basically calculate margin rates of substitution. And then we can basically calculate something which we call the willingness to pay for reduced unemployment. And that is here taken simply by multiplying this number here by the monetary value of one WELLBY, so 1 unit of life satisfaction for one person 1 year, which we estimate to be £9,000. And then we get these numbers here. And what we also do is we first of all add all of these up over the years. So we get sort of the misery, the monetized misery, which would be omitted in traditional cost benefit analysis. But we also know from the life satisfaction literature that misery of unemployment is not a single affair. Misery of unemployment is also shared within the households. There are there is something which we call a social multiplier. We just take here a social multiplier of 2. So we simply assume that, you know, your partner will be also experiencing sort of like the joys of not being unemployed. So basically that is sort of passed on. How this social multiplier, how big that essentially is ultimately an empirical question. I mean, we take here a simplified value of 2. I think Paul has a study, I think Mervyn and Frijters 2014 estimated to be around 1.5 for intra-household spillovers. We simply take 2 here. So we take this 2070 times 2, and then we basically have the absence of misery that comes from being re-employed or being employed for these young people, which then of course can be added, because it's a monetized value, which can be added on the benefit side, and actually shows that if you do account for sort of the avoided misery from actually bringing young people into work, that actually tilts the cost-benefit analysis, the traditional cost-benefit analysis, here in this well-being augmented cost-benefit analysis more to the positive. So actually makes this program even more worthwhile. What we can also do, and that's sort of like the long-term stage, but definitely something which we recommend, is what we call a well-being cost effectiveness analysis. The idea behind the well-being cost effectiveness analysis is that we simply sum up all the benefits of a policy in terms of well-being, so in terms of life satisfaction points, over all individuals and over all time periods, and simply divide them by the costs to get what we call a well-being cost effectiveness ratio, which we then compare, as Paul has already said, which we then compare with a certain threshold ratio. And if it's above this threshold ratio, which is, if you remember in the previous figure that Paul shared, was the horizontal line, which was labeled NHS marginal. If it's above this threshold, then, you know, the policy is worthwhile to implement. And if it's below that, it should not be implemented. So that's sort of like the long-term, perspective of where we can use well-being data and well-being data for policy analysis and evaluation. And if we apply this here to our Welsh traineeship program, what does that actually mean? Well, we can look at here at the effect of higher personal consumption, which is simply taken from the previous slides. We can convert this in life satisfaction points. So we know the life satisfaction effect of log annual household income. So we can essentially calculate the life satisfaction effect of higher consumption from this, essentially basically transforming this monetary value back into a life satisfaction value. And then what we do also here in this particular example, we know that private consumption is, of course, subject to status externalities, so private negative consumption externalities. So people might be jealous of each other and so on and so forth. There's lots of evidence in behavioral economics literature that, something like, whether you attain a job rise or income rise, basically people in your immediate comparison group actually simply in simple terms get unhappier from that because they are jealous. So some of this increase in private consumption or these life satisfaction points that come from this increase in private consumption should be discounted. In our book, we introduced something which we called an Easterlin discount. So essentially, we basically say that, okay, where we need to discount some of this increase in life satisfaction points, and we basically suggest an Easterlin discount of 75%, right? So that only 25% actually do account in life satisfaction increase. And that's sort of like the benefit in terms of higher personal consumption in life satisfaction points. Again, the rest is pretty much the same. What we have here, we basically take the life satisfaction effect of avoided misery, take the local, take the social multiplier times 2, and basically sum this up. And you can see here that actually, if you look at sort of this Welsh traineeship program from a wellbeing cost effectiveness analysis perspective, you can see that most of the benefits of the program actually do not come from increased private consumption, but actually come from avoided misery of that individual, which actually goes beyond simply income losses. That's life satisfaction points. We add them all up. We do have also cost savings in terms of crime as before, healthcare cost savings as before, and also higher taxes. So we do have these as sort of like savings to the public purse. At the same time, we have program costs. What we then calculate is the net public costs. So we do basically subtract the cost savings from the program costs, and then we get net public costs here. Take the life satisfaction benefits, divide them by the costs, we get a threshold. That threshold here is our wellbeing cost effectiveness ratio, 0.009795. That is actually higher than the NHS marginal, which is 1 divided by 2,500, which is 0.0004. So this is, according to this calculation, a very worthwhile program. So in the end, probably, if we do have a government that only cares about WELLBYs, about life satisfaction points, then essentially we can evaluate all policies only in terms of wellbeing cost effectiveness analysis. The benefit here is we do not really have to translate life satisfaction points into money, which makes certain assumptions, right? We need to have a good estimate of the effect of income, a good causal estimate of the effect of income on life satisfaction. We avoid this if we do a wellbeing cost effectiveness analysis. And ideally, a social planner who cares about well-being and wants to maximize well-being in society, essentially then basically calculates wellbeing cost effectiveness ratios for every policy, ranks these policies from the highest cost effectiveness to the lowest cost effective in terms of well-being, and then simply executes this list, runs this list until the budget runs out, and then essentially you get to the threshold value which you want to use, and also the shadow price of well-being in society. That's one example which we have from a book. You can see that the bottom line is that sort of traditional CBA, well-being augmented CBA, and sort of this long-run vision of well-being cost effectiveness analysis, they all suggest that this is a very worthwhile endeavor, a very worthwhile policy. But if you can see that sort of like the mechanisms and why the story behind why this is a worthwhile policy actually does change. Whereas in traditional cost-benefit analysis, it's mainly due to higher private consumption, private individual consumption. If we move more towards wellbeing augmented CBA and also wellbeing CEA, we can see it's actually more about avoided misery of unemployment for the individual who is affected by unemployment, but also for like the social network of that individual, so particularly significant others who live within the same household. I would like to use the last 10 minutes to give you one example about volunteering, an example where we studied a policy during COVID-19. So in the UK, we basically had a huge increase in volunteering during COVID-19, which was partly run by the Royal Voluntary Service and the NHS, and they run a program which was called NHS Volunteer Responders. And at the beginning of the first lockdown in 2020, so in March 2020, there was a call for volunteers to help people who were shielding and couldn't leave house to get medical supplies and basic groceries to help them essentially run their errands and run their shopping and get medical supplies and so on and so forth. And there was a huge nationwide call, and within 24 hours, around 750,000 people stepped forward to actually help. That's more than 1% of the English population. Step forward. They wanted to get 250,000 initially, but this program was so heavily oversubscribed within 24 hours. So many people stepped forward. So it's really great to see that. And what we did in our research, we studied the causal effect of volunteering in this program, the NHS volunteer responders and volunteers' life satisfaction, and we did this in a causal way, in a causal design framework, by simply exploiting the oversubscription to the program, comparing those individuals who actually got to volunteer with those individuals who stepped forward and wanted to volunteer but didn't get to volunteer because there was not enough work for them, right? Because there were too many volunteers. So by comparing them, we basically found out that volunteers basically benefited greatly from helping other people. Their life satisfaction really increased in a very strong manner, and we basically can use these estimates, so this life satisfaction increase, to compare the benefits of the program with the costs. And these are some of the recruitment aspects or photos here of the program. It was basically app-based. So if somebody needed help, they could ask or put a request into like an app, and volunteers basically were alarmed about a request in their surroundings, and then basically could fulfill this request, for example, doing shopping for elderly people who couldn't leave the house because of the danger of contracting the virus. So we did a well-being cost benefit analysis of this program, and just to give you some preliminary background about the costs. The program, the program is still running, but essentially our observation period is from April to July 2020. So during the first lockdown in the UK, the cost of running these NHS volunteer responders, because it was pretty much app-based, was very, very low. So it costed only about £3.1 million. 2.7 million were direct costs incurred by the NHS, so the National Health Service in England, and about 350,000 were developer costs of like adapting the smartphone app to the current pandemic. And so what we asked ourselves was, were the benefits of running the program worth the costs? And basically what we did is we did two types of analysis. We did a well-being cost benefit analysis and the well-being cost effectiveness analysis to answer this question. And I'll show you quickly how this actually worked. So focusing first on the well-being cost benefit analysis, we found that using our causal design framework, in which we compared volunteers who got the task with volunteers who didn't get a task, and we found that volunteering benefited the volunteers who got a task very much. It increased the overall life satisfaction on a 0 to 10 scale by around 0.17 points. That's the first thing we need to note. Then we need to note that a 1% change in log annual gross household income increases overall life satisfaction by around 0.007 points. Take this estimate here by Sachs et al. 2010, so that's a rather large estimate. In the book, actually, we suggest a lower estimate. I'm taking here a larger estimate because that's more conservative. At the same time, we basically also know that the median annual gross household income in England in 2019 was about 29,600, or if I break this down to the months under observation, that's around 7,400 pounds during the period of April to July 2020. So what we're now doing is the next step, we're calculating the marginal rate of substitution between volunteering and income, and weigh it by the mean income which was generated during that period under observation. And if we do this, we basically find that volunteers would have to be compensated with, on average, around 1,800 pounds to reach the same, I shouldn't say utility level, to reach the same life satisfaction level in the counterfactual case in which they had not taken part in the program. So it's actually they generated quite a lot of well-being benefit from actually helping other people. If we monetize it, that's around 1,800 pounds per volunteer. Since there were around 250,000 volunteers who actively participated, we basically take this number times 250,000. We get a total monetized benefit of 445 million, and then the net benefit essentially reducing or subtracting this 3.1 million of running the program, we get a total net benefit of the program according to our well-being cost benefit analysis of 442 million, which was generated for volunteers only during these 3 months. Probably a lower bound, doesn't account at all for the well-being benefits to the recipients of volunteering. It doesn't account for knock-on effects or intra-household spillovers, as we've seen in our other examples. These are, as we know from empirical evidence, these probably matter quite a lot. So yeah, so essentially that's a huge benefit and probably a lower bound. What we can also do is we can look at the same thing, because you can see here from this well-being cost benefit analysis, if we calculate this margin rate of substitution, we essentially rely on a causal estimate of income on life satisfaction. And that's sort of like still a little bit contested. We need to have good estimates there. There are lottery studies which try to bypass that. There are also like minimum income examples, which are universal basic income examples, which are coming up, where we probably also get better estimates. But again, it relies crucially on this estimate. And we've seen from the previous example that if we run a well-being cost effectiveness analysis, essentially we can bypass this problem. So we simply sum up all the benefits of life satisfaction divided by the costs. If we do this here and calculate this well-being cost effectiveness ratio of the program, we basically take our individual life satisfaction benefits, 0.17 WELLBYs, times 250,000 individuals who profited, who volunteered, divided by 3.1 million, we get a benefit ratio of 0.0137. So it's again very high. Again, we can compare this with our basic threshold, either 0.004, so 1 divided by 2,500, or I'm taking even a more conservative one, so to be 100% conservative here in this analysis, which is 0.005. Again, we can see that it's much greater than that. So we can see that very likely, again, even if we look at that from a well-being cost effectiveness analysis perspective, it's quite likely that running these NHS volunteer responders program was actually worth the costs. And I think this is probably the point where I would leave it, and where I think we would open the floor for questions. And thank you so much for your attention and for coming. And so we're looking forward to your questions. I've seen there were already quite a lot of in the chat.
Thanks, Christoph. Thanks, Paul. Let me moderate questions, but happy to put more questions in the chat. But and there's been a very vigorous conversation in the chat as we've gone. But at least a couple of them might start off with a couple of the thoughts. I mean, there was a vigorous part of the chat on is your methodology affected by cross-cultural events? In other words, does this apply for different cultures and other than England?
Yeah, so that's actually really, really interesting. There are cultural differences, I think, between, for example, Western countries and East Asian countries. I'm not a super expert in that, but there is sort of like the value that people put on happiness seems to be slightly different in East Asian cultures. Although not fundamentally, but there is some sort of like permission element in terms of, should I be allowed to be happy? Is this something that is worth striving for? Should I feel actually guilty if I'm happy, and so on and so forth? So it's most of our evidence that has to be said comes really from we call it weird countries, so mostly Western countries, industrialized countries, high education contexts, highly economically developed, and so on and so forth. So that's sort of like where the evidence comes from. There are cultural differences. I think we need to do some more research actually to dig into this more deeper. But I think Paul has also a firm opinion on that.
Yes, I do. I mean, the cultural aspects of well-being has been discussed for a long, long time, and psychologists have been at this for about 50 to 60 years. But I mean, from my point of view, I think the news has been good in the last 50 years, and that cultural differences have been exaggerated in many ways. So, as John Helliwell said, one of the rules of thumb that comes out anywhere you want to look in the world is of the extreme importance of good social relations. Now, that's true for Papua New Guinea, and it's true for Costa Rica, and it's true for the Inuit Indians, and it's true for the South Africans, and it's true for the Russians. And you wouldn't find that in traditional economic CBA analysis. Also, as it were, the idea that government is there for well-being is not really a very controversial one, even in East Asia. So Hong Kong has these kind of indices. South Korea is busy with that. The Chinese are quite comfortable with the idea that, okay, maybe that's what we should do. In Latin America, it's a fourth. The North Americans have this in the preamble to their constitution. So that thought too is in many different cultures. And so we've not really found huge areas of life in which, as it were, the degree to which they're valued across cultures is all that different. But it is true that you have to boil it down to what matters. And so if you say, for instance, well, is marriage worth the same in each culture? You will get very different answers, because the difference between marriage and cohabiting is almost zero in Australia, New Zealand, Germany, and the Netherlands, but it's very big in the US, very big in China. There, it's a sign of social status. And so if you indeed look for, what is the cultural value of marriage, that'll differ tremendously over cultures. But if you ask, well, how important is it to have a good, warm social relationship? Well, that's the same, right? So you got to boil it down to things that are, as it were, speak to the fundamental human condition, right? And you've got to boil it down into, okay, what is high status, what is low status? And that can be culturally specific, the high status, low status things. But that status is important. That's true as well wherever you look, right? So you got to look at the right set of goods that's fairly universal.
Thanks. There's a long thread here too about, I think, capability. Starting up. What do you think the capability in countries are? Say in New Zealand, the sophistication of your methodology. Do you think that the capability could be there or should be there?
I have an opinion on that, which is that this is, as it were, the capability determines where the low-hanging fruit is. So for a place like Bhutan, which has nowhere near the analytical capacity of the New Zealand Treasury or of its departments, this kind of well-being cost-effectiveness methodology is totally and utterly useless. It's just far too complex. They wouldn't know how to deal with the price list. They've only got 500,000 people in the country. What they are helped with is more these rules of thumb as to, okay, what is something that is very important, what is not so important, the national pride versus national consumption. That kind of simple price list is probably the most powerful for a country that just doesn't have a very sophisticated bureaucracy yet and is not really in this experimental mindset, which has a lot of data sets ongoing, which knows how to read international literature. That just takes an awful lot of investment to have a bureaucracy to do that. So yeah, there's a little bit of horses for courses as to where the low-hanging fruit in the well-being literature is for different countries. But New Zealand is part of the sophisticated bureaucracy countries, and hence can do this kind of optimization on the basis of experiments. And we try this in that region, and then we update our ideas, and we've got running frameworks. I mean, you can do that, but many countries in the world can't.
And probably a question for you, Christian. Can you think of an example where the calculation of WELLBYs has made a project look less attractive? The examples you gave us made the projects look more attractive, but in your experience, have you seen that?
That's a very good question. Actually, I am not 100% sure whether I come up with a good example right now. That's a really good question. Paul, can you come up with a good example?
Yes, but of course, as soon as that happens, departments don't want to tell you about it. So, the Department of Transport and Housing was very interested in making sure that houses became bigger because, they thought it was a problem that people lived in cheap housing, so wanted to get them to richer housing. Now, it's a little bit murky as to why they wanted that, but they wanted to value these, as it were, bigger and more expensive houses by their market price. But of course, housing is largely a status good, and so the bigger house of the neighbor will make everybody else more jealous. So the net benefit of all these bigger houses on well-being is virtually zero. And they didn't like that particular thing, so you won't hear much about it.
I could imagine large infrastructure projects. I mean, not that I've evaluated any of those, but like HS2, for example, in the UK, which basically promise, reduced commuting to a certain extent. And we're not really, I mean, the causal effect of commuting on well-being is not at all clear. because people like substitute commuting time also then with working and then also commuting alone. So basically, I think that it's probably overstated how bad commuting really is, but sort of like these kind of things where, you know, you basically, I could imagine like large infrastructure projects, like also the Heathrow one-way expansion probably. It depends on how big the sort of like intrusion is into sort of like, you know, natural environments and displacement of homes, for example, which I think, you know, basically in this table that Paul showed was just like, didn't even get any quantification, monetary quantification, but simply like traffic lights, right? Because it was difficult to quantify. So that's sort of like, these are sort of maybe the suspicious cases where actually, yeah.
Another question is that the specification of social weights seems quite an important step in the process. So could you comment on how public servants might approach this issue, given that reasonable people can and do disagree about the right way to deal with questions of distributive justice?
Yeah, so I think distributive justice essentially, I mean, that is, the methodology is basically free of any sort of ideology. I mean, you can basically apply social weights as you seem fit, right? I mean, what we essentially want to do, ideally, we want to sort of prioritize people who are sort of at the lower end of the well-being distribution. So particularly those people which we call are in misery. I think also most policymakers would naturally agree that, although they don't necessarily agree that, you know, happiness should be the goal, but most policymakers do agree that sort of misery prevention, alleviation should be the goal. So people, particularly in the ranges of 0 to 4 life satisfaction points, are what we consider in misery, because there we have correlations with, you know, substance abuse, depression, homelessness, and so on and so forth. So everything that is on face value quite bad, and, you know, putting more value onto those people particularly, I think that's something which the methodology can easily do.
I would like to give a slightly different answer. Some people have said that misery should count extra, though for me, that is less important. But this notion of how much people with different passports should count, but also people who are not yet born should count. That's a really difficult one within this methodology, because we care about the idea of a next generation, but as soon as you say the unborn is important, you get the unpalatable corollary that maybe we should spend a lot more resources on making sure we have more children, right? And lots of people don't like that, but they do like the idea that the future generation matters. So there is a natural tension there. But for us, as Christian said, the methodology doesn't take a point on that. But one way to do that is to see this as essentially a definition of who us is, who the us of the calculation is, right? Economists traditionally come from a kind of a world utilitarian background, but in reality, the world is more organized in terms of nation states, and bureaucracies of nation states have a democratic duty to care about their population and not that of the whole world. And so there is this notion of, well, who's the demos? Who's us? Who are we supposed to care for? And in principle, you can either take your answer from politics, which means whoever voted last time, which is also a bit unpalatable, or you can run surveys and ask people, well, you know, okay, what weight do you think, you know, the unborn children should have relative to you? Or look at this hypothetical New Zealander. He hasn't been here for 20 years. He might not even know he's New Zealand or has a right to that, right? But should he calculate? Should we care about him? Should we divert resources away from you to him if that would help? And you can put hypotheticals there. So I'm sort of enamored of the idea that you can just ask people in New Zealand, well, who is us? And give them weights. That's one way to go.
Thank you. There's a specific question, but I think it's more generic too, because there's a lively debate in the chat. The question is, does or could the WELLBY approach take the well-being of one's family into account? But further up the chat too, there was a vigorous debate about what that family was and some of the externalities, both positive and negative in that.
Yeah. Well, I mean, I like the quote of Adam Smith, who said, look, philosophers effectively worry about, you know, the happiness of the whole world and mankind from now till infinity. And effectively, that's rather useless. People should stick to what they're better at, which is looking after their own happiness, that of their family, that of their community, and maybe their country, right? And I like that kind of more practical approach. Let's worry about the happiness of the people we know best. And of course, part of the nation state bureaucracy, the Treasury and the departments, well, that's their job to worry about the well-being of all New Zealanders. But for individuals, yeah, there is also a responsibility for their own and that of their family. And that goes again to the question within a family, well, who is us? And how much do we care about other people's family in a direct sense? And I think that as moral actors, these are kind of questions we struggle with daily, you know, and in that sense, you know, my family first is something that I would practice as well, right? I advocate WELLBY for society as a whole choice, but of course in daily decision making, I count my own family larger than anybody else's family, and I think that's natural, and everybody else probably does the same. But as a system to govern all of us, you know, we want the bureaucracy to care about all of us equally.
Thank you. And then another one is, does the WELLBY approach for CBA link back to general equilibrium theory like price-based CBA does? I'm thinking about double counting risks as the impacts ripple through risk markets, or about budget constraints in particular. Willingness to pay values exceed people's ability to pay. And that echoes an earlier comment in the chat too about, I think from Kath Wallace, saying, well, you know, the story relies on incomes and wealth at some stage.
Maybe I can answer that. Yes, in principle, I like the idea of general equilibrium thinking, which is often that, you know, a choice for one means a choice against others, and one has to live within one's means. And of course, the whole idea of status has an equilibrium in it as well. But that's a question of which frameworks one adopts, right? So how the world works, if you like, has an equilibrium notion in it. And in that sense, we're totally pragmatic. I mean, we come from an economic tradition, so we're generally equilibrium thinkers, but that will differ department by department. And that's sort of a fight between departments and organizations within a country as to whether or not they should be equilibrium thinkers. And we don't want to get into that fight, but definitely that's something you want to do to avoid double counting. And we talk a lot about that, right? And this is indeed a question of a good example of double counting is that you shouldn't uncount the well-being effect and then try to account the health effects as well, because they're already in the well-being effect. You know, when you've got an ultimate measure, stick with it. Don't count something else of the same people as well. It's, and that's a matter of of sort of, you know, practice of analysis, if you like.
Yeah.
Christian?
Yeah, no, I agree with that. I think we do have a chapter in the book actually that sort of deals with that particularly. So I remember when in doubt, leave out. That's for the benefits. For the costs, it's when in doubt, put in.
Chapter is a wee bit provocative, but I think it's getting at something important too, which is using your methodology about time consistency. In other words, in applying this methodology, is it subject to repeat games? So the comment is, suppose the NHS had cause to run the program again and it were oversubscribed, and suppose the NHS had read the paper and told potential volunteers, we know from the best social science that participation in this program provides well-being worth at least £1,000, and we don't have room for everyone, so we're charging you £200 to participate.
This would be such an interesting experiment, I have to say. It would be fantastic. I think what I like about the NHS example is that actually they're thinking to like run this now in normal times as sort of like a nationwide thing. So I think it would be fantastically interesting to see what would happen if, I mean, rationally, of course, it would, as a rational agent, you would, of course, then select into it. I think it would, however, of course, deter most people who are sort of like pro-socially motivated, and it would probably crowd out intrinsic motivation to actually give time. But it would be a fantastic experiment to do.
I can comment a bit more on that. Within the general methodologies you saw, we have a discounted stream of well-being in there, and because it's sort of a standard discounting stream, normally speaking, you don't run into time inconsistency problems with that, right? Because as we're from the point of view of tomorrow, how much you care about it tomorrow is indeed what you'd have cared about it today already. But of course, the reality of election cycles is always that there's a time inconsistency problem in lots of things. But to take the specific example of the NHS, you do have to worry about, you sort of have to have a slight change of mindset there, because as soon as you ask money of volunteers to become volunteers, you're changing the nature of that relationship. They're no longer volunteers to a certain extent. They're suddenly sort of, you know, consumers who are paying for their own entertainment, like going to the theatre. And that comes with a totally different mindset. So one should be mindful of the fact that explicitly introducing money around volunteering changes what it actually is. It no longer is volunteering, and hence changes the psychic properties of it. And I think that economists don't think that way. They don't think that money changes the nature of a relationship, but they intuitively do recognize it. So if I, for instance, ask you, would it make sense to give your friend $20 if you enjoyed his meal, just to show your appreciation? Even an economist will recognize that's ridiculous, and that sort of is an insult to your friend, right? Because he likes to make dinner for you. But as an economist, one should then also not go to work and then nevertheless have that mindset when it comes to asking volunteers to pay for the privilege of volunteering. Right? You should realize that's like paying a friend $20 because of the delicious dinner he shared with you. Right? So one should basically have an expansive notion of how people really are when it comes to that kind of asking money for something that was previously not measured or valued in that monetary realm.
Yeah, it's also like, to just add to that, even if you would leave out the 200 payment, even if you just like present people with information, well, this is the monetized well-being benefit you generate from volunteering. Very unclear whether people would still select into that, because, you know, I mean, there's all this literature on failures in hedonic forecasting, and essentially volunteering is an experience good, right? I mean, you basically don't believe that you generate so much well-being benefits from before you actually volunteered. Only if you have done it, actually, you basically see that. That's why volunteers then also keep it up, because they have this positive feedback. But it's difficult to like get people into volunteering by just presenting them with the benefits. They just need to try it out. Need to nudge into that in other ways, probably.
There's just a supplementary comment on that too, which worth just noting, I think, but a comment that you know, desirably, wherever possible, we should check back and see, you know, check some of these willingness to pay that's consistent with the assessed valuation. And I think there's a sense in that. Can I just take you back to a supplementary on another question too, which is, no, I've lost it. I was doing a brilliant job, I thought. There was one on, here, yeah, there was, back to the discussion we had on the risks of double counting, and there's a comment about, does a multiplier for the family risk double counting? How do you think about that?
Well, the multiplier for the family, this goes back to the unemployment multiplier, right? That social multiplier. Yeah. I mean, empirically speaking, that multiplier is largely the whole social surrounding. So we know that unemployed people are sort of less friendly towards the friends that they have. They become more depressed. They become isolated. And so part of the loss is sort of loss of motivation and depression in the rest of the family. And that is there, right? But also in the rest of the community. So Andrew Clark sort of has a nice paper of that a while back, who suggested that the whole community loses at least double what the individual loses. But there is some evidence that goes against that. But I once commissioned 20 papers as part of the World Econometrics Challenge of various teams around the world, and they all came on a multiplier of 2 as well as their best estimates, using all kinds of data based on changes in unemployment in regions around the world and around time. So it's that number sort of comes a little bit from the community effects. And it's not really double counting, because this is the actual life satisfaction effect in the country as a whole of changes in unemployment. That's what it relates to. But of course, if you include that multiplier, then you've got to be very careful if you start also including the effect of the money stream differences with unemployment. Right now, frankly speaking, they're so small relative to the misery of unemployment, you might as well not count them, right? Because the misery just far outweighs any monetary effect on that. But yeah, you've got to then be careful, as it were, with the other stuff you count. And so it's good to have rules of thumb in one's own mind, which is often that, you know, economic recessions are important because of government debt and unemployment, and the rest almost doesn't matter for the WELLBY methodology. The rest is sort of very, very small.
Yeah, I think that also doesn't, I don't see any risk of double counting in terms of this social multiplier parameter, because the WELLBY is sort of the net welfare measure, and you would start double counting if you would then also include, okay, the health effects of sort of like your significant others and things like that. But essentially you look at sort of, I wouldn't say the utility, but you look at sort of like the welfare, the net welfare measure in the end of these other people. And the parameter where this thing comes from, I mean, this is now estimated to be 2, but it might also be changing over time. So essentially, we might want to give it a sort of like a subscript of T, right? We want to commission new research every 5 years, saying that just testing whether this parameter does actually change as social relationships and households change over time. Right.
Thanks. We're getting towards the end too. It's been vigorous, but I'll ask you another question, and then just anybody out there, if there's got a burning question they want to pop it in the chat, and I'll make sure we have a chance for that. But another question going back a bit was, does the WELLBY approach evaluate effects on environment and animals based on their impact on happiness of people, or is it something more intrinsic?
Happiness of people. That's pretty much, it's very anthropomorphic at the moment. One can in principle extend it, but it's definitely seen as humans first. One can in principle put animals in there, yes. The implicit thinking is though that we're sort of helping nation state bureaucracy figure out their democratic duty. And within our systems, animals don't vote in parliament. They have no power other than the power of humans protecting them. So there's also an element there to which is when our kind of methodology of thinking respects the reality of power. And the reality of power is that humans have power and animals don't. And one can say, well, we don't want it that way, but who's the we? It's we humans don't want it that way. So that's just another way of saying, yeah, we decide for animals anyway, and we can internally disagree, but it's still us that matters.
Yeah, that's true. But I like about the methodology is that it's actually quite flexible, and you could essentially include animal welfare. So that's something you can actually do. It will be difficult to assess that, but there are studies. I think Andrew Oswald has worked on that, on sort of looking at the midlife crisis in chimpanzees and basically having their well-being assessed by their caregivers. And so actually the methodology would be flexible. Whether you want to put it in, I think that's something, as Paul has said, it's probably more the negative. But I mean, it's also like if democracy decides on that's something we care about, then we can put it in.
Fantastic. Look, I might draw us to a conclusion then, but just in closing, one, I just want to thank you both for the sacrifice you're making and getting up at some ridiculous hour in the morning, let alone the stresses and strains of trying to do a significant presentation like this over the net as well. But I found it absolutely fascinating because the problem is really fundamental. It's how you take the benefits and the rigor of something like cost-benefit analysis, but make it much more real and recognise the areas that actually matter to people's livings and their well-being. And that's quite fundamental. And what I like about what you're doing is to try and make that really practical, to take these really, really difficult issues and actually put them into a practical basis. And I'm certainly hearing about what you're saying about that cost of the tables being owned by the bureaucracy, because that's where a lot of these decisions get made. And for me, it's just so important. I'm so thankful that you've both taken the time to not just apply your wisdom, but actually help us think about how we're going in the work we do here as well. So I just like, and I'm certain that our colleagues will enjoy a huge turnout. 150 odd people here to talk to you today. So that's pretty impressive. And thank you for your open and candid and really thoughtful and amusing at times replies to some of the questions. And the chat, I have to say, was beyond vigorous. I mean, in terms of the questions, the comments and things like that. So thank you very, very much indeed for that. And in just closing, I'd say piki te kaha, piki te ora, piki te wairua, maori ora. And thank you very much for participating, everybody. And thank you, Paul and Christian.
Thank you so much.
Thank you.
Take care.
Bye. Bye all.